Hi, my name is Laura Kohler, and I'm going to talk to you a little bit today about our virtual programs here at Linden Oaks. And so we created virtual programs back in March as a response to COVID-19 pandemic. But we also now are seeing that the virtual option is also helpful for individuals with transportation issues or live farther away. And so all of our virtual programs are modeled after our in-person programs. So we try to make them kind of match as best as we can. And so all of our virtual programs are intensive outpatient programs. So that means they're 3 hours a day, 5 days a week, and they are in a group format. We have programs for both adults and adolescents. All of the staff that are in the virtual programs are working outside of our Naperville outpatient location, so that way we have the entire team together. So we still have our medical providers, we still have our nurses, we still have the entire team working together. Patients can participate anywhere in the state. However, if someone is looking to join one of our addiction virtual programs, they will need to come to our Naperville outpatient location at least once a week to do a drug screen. The equipment that's needed for the virtual programs is that we need the individuals need to have an electronic device with a speaker, a microphone, a camera, and then internet service. And so how does one get into the virtual program? So we do a level of care assessment just like we would do for our in-person programs. And those can either be done in person or virtually. And so once that level of care assessment's done and it is determined that a virtual program is the best fit and the individual agrees to start the program, then what will happen is that the next business day, a staff member from the program would reach out via telephone to the individual and then discuss with them about creating an orientation for it. So that's usually our first day of program, is this like orientation day. And then what that would consist of is setting up the virtual platform, which our virtual platform is secure and HIPAA compliant. And so the staff member would email instructions, and then we would set it up to make sure that it's working. We would also review program specific paperwork, such as like contracts and releases of information, group schedules, who your treatment team is going to be, as well as a nursing assessment with a nurse, and then a psychosocial assessment with a clinical therapist, and even possibly a psychiatric evaluation with a medical provider. So that first day can be filled with quite a few activities. And then also what will happen on that first day is that your clinical therapist would email with their personal meeting ID for the platform, for the virtual platform. And so those personal meeting IDs are very similar to like a telephone number. So how each of us have our own telephone number, we also have our own personal meeting ID. And then this way the individual can be ready for day 2, which is then when they would join the group, the virtual group itself. And so it can be helpful to check your email for any sort of updates with that personal ID or with group worksheets, something like that. Once the second day happens and the individual joins group, there's 2 kind of main views that you can do on a virtual platform. You can do what's called like a grid view, where it's a bunch of little squares. And that kind of looks like the Brady Bunch squares. Or you can do what's called like a speaker view, and then it's like who's ever speaking is a bigger picture, and then all the other group members are little squares along the top. And so the participant gets to pick which one fits best for them. Like I said before, our virtual programs are set up just like our in-person ones. And so they're 3 hours and 15 minutes because it's 3 hours of programming of therapy with a 15-minute break in the middle. The clinical therapist is the host of the meeting. So because the clinical therapist is the host of the virtual platform, is that the clinical therapist needs to open up the meeting. So if the group members join, a couple minutes before that clinical therapist, what they're going to end up doing is waiting in a virtual waiting room or lobby. And then that clinical therapist will open the room up and admit people in. And the reason we do that is to ensure privacy, to make sure that nobody can get into the room that shouldn't be there. And so then the group schedule typically looks like it might be a little different depending upon what program you're in, but for the most part, they all have one check-in or process group, 2 skills groups, and then a wrap-up group. And in that wrap-up group is where we probably differ the most from an in-person group, because we want to make sure to individually check in with each group member. And so what happens during that wrap-up is that we'll kind of talk about how we can use our skills for the rest of the day, and then all of the group members get put into that virtual waiting/lobby where we're asking them to review skills, how they can apply it to their life that night. And then the clinical therapist has a group member come into their personal room one by one to do a safety check as well as just do an individual check. So then that way they're still getting a little bit of that personal time, and then they would be put back into the lobby waiting room to continue looking over the skills that they taught that day. Outside of group, we would also do an individual session as well as psychiatric appointments, and those would be done outside of the 3 hours and 15 minutes of group, and they would be scheduled ahead of time, as well as, again, all of those personal meeting IDs. So the medical provider has their personal meeting ID as well, and all of these appointments would be virtual and all be scheduled ahead of time. The typical patient to clinical therapist ratio is about 7 or 8. As well as some of our programs, some of our specialty programs are what we're calling a hybrid, where there's in-person people as well as virtual people in the group as well. And so we sort of have this set up just right we have 2 laptops, so that way one laptop is facing the clinical therapist, the group leader, as well as another laptop facing out to the group. So then the people that are in person can see the people on the computer, and the people on the computer can see the people in person. So as well as then we have a microphone that's on a long cord that sits in the center of the room so that everybody can hear everybody. And so like I said, some of our specialty programs are doing that because we don't have the ability right now to be able to run both an in-person as well as a virtual. So we're doing them together, and so far the feedback is that it's working quite well. And so this way we can still make sure that we're reaching everyone who's in need. And those are the primary topics of the virtual program. So if you would be interested, or if you have someone that you know that might be interested, you could give us a call at Linden Oaks to set up an appointment to do a level of care assessment, and 630-305-5027. And then you can either set up an appointment or ask for questions. Thank you.